All right, so Taylor Bradford, thank you for being with us again today. Nice to see
Thank
you.
you so much for having me. Appreciate it.
So you have an interesting article this week on what the school nurses in Gloucester are up to.
Yeah, so the school nurses, right, that they've been going out and checking in on those who have potential COVID-19 symptoms and checking in, trying to see they are now involved with the tracking with the primary contacts and connections of people with presumptive and confirmed cases of COVID-19. So what that looks like is coordinating wraparound services for residents in mandatory quarantine or isolation, making sure that they have access to groceries and the essential household items that they might need for either children or disinfectant wipes for them and their loved ones. Because if you look at the numbers now, as of Monday, they had 65 confirmed cases, 4 deaths, and 13 in home isolation. And so there's about 4 in hospitalization, and then I believe 44 have recovered, which is amazing. And again, kind of talking and seeing. This is everyone coming together to care for everyone. I was able to speak with Cindy Junker, who's the head nurse at the school nurses, and she's talking about all that she's involved in and how she sees her nurses going out and trying to make sure that people stay healthy and kind of are able to continue on with daily life while also trying to navigate this COVID-19 crisis. So especially for children who are going to go get their meals around 2 to 4 o'clock at the different pickup sites for their lunches, she's having nurses go and kind of help make sure that things are clean. Those who are presenting the lunches and breakfasts to the students are sanitized, make sure everything is wiped down, ensuring that these people are staying safe and that kids and parents can come in knowing that they've taken the precautionary measures to ensure their safety for both the workers and for the students and children. So
could you just explain a little bit about how this works? The patients are identified as being COVID positive, and then the nurses talk over the phone with them about everyone they imagine they have had contact with, and then the nurses reach out to them. Is that right?
Yeah, so contact tracing, how that works is, right, once there's been somebody who's been identified as either a presumptive or confirmed case, whether that is them driving to one of the places to get tested, or right, talking over the phone and saying, okay, you have all the symptoms, and so we're going to treat you as a presumptive case. And so from there, each patient is identified by number and nurses are assigned a case. So from there, that nurse has that case, and then that's when the interviews start happening. They ask them the preliminary questions. They try to figure out where they might have been that they could have picked up the disease. And then, the next questions are, who are you in contact with? Because that's the biggest thing, is that's how this disease spreads, right? Is not practicing social distancing and connecting with one person, another person, and then those people connect with other people. So they are really trying to figure out who their contacts are and then inform them. And so then things start happening. And then if those people start to pick up symptoms, they'll be assigned a case as well. So the patients provide the health department with that list, and then the cases are followed by the health department until the patient's cleared. And that's meeting a state criteria for the release. And then all that data is gathered and it put into a system, and so recording. So that's how throughout all this pandemic, we'll have all those numbers, not only within Gloucester, not only within our state, but kind of across the board nationwide. So it's a lot of numbers, a lot of keeping tabs, and nurses are trying to do this remote as much as possible to ensure the safety of both the patients but also themselves, because they're not able to do the work if they're sick themselves, and we want to make sure that they can limit contact as much as possible. Is what really Cindy was talking about, is trying to continue their work and do it well, and they miss their students, but at the same time they can't have that contact. So just a little bit of a snippet of what we were able to talk about the other day. So
A lot. It's a lot for the school nurses to take on when they thought they were going to be in isolation, right? This is a big project, this contact tracing.
Yeah.
And the supportive services. So what are you working on now this week, Taylor? What's coming up?
Yeah. So we've got a couple meetings. I think the city is really taking this time and utilizing the online resources of Zoom to really address the different things that need to happen within the city that aren't related to COVID-19 but have to respond to COVID-19. So we have a city council meeting tonight at 7 p.m. and then tomorrow we have a school committee meeting at 7 p.m. And so the school committee, they're going to be talking about April vacation. Students out there, kind of maybe you want to tune in Wednesday night to kind of see what the school committee decides. Either you're going to have school from Tuesday to Friday that week, or you might not. So definitely check in there to kind of see what they decide. I know that they're talking about canceling April vacation, keeping Monday, of course, so that's a holiday, but definitely that's something that people are wanting to tune into. And then tonight there's a lot of discussion about, you know, how do they continue on with the city? How do they continue on with the East Gloucester building project and, you know, special permits and trying to do building projects that were planned and kind of had started the processes way before all of this happened. And so, you know, what does it look like for them going forward as they kind of wanted to get those projects out of the way? So city council meeting tonight, school committee tomorrow. And again, the city is always bustling with news and different events and activities. So we'll see what comes next.
And there's often caution tape around the city these days.
Yeah. Yeah, I know we had it at the footbridge at Good Harbor and then outside St. Peter's Club. So those were not put down by the Department of Public Works. They made that quite clear on their Facebook page. And the police kind of emphasized that. But I think people are getting creative. Definitely, you know, they're saying do not do that. Not a prank, but definitely kind of made a statement. You kind of see the tape up along the footbridge, and then, you know, people are saying don't sit on the benches. So I don't know when we'll be able to sit on the benches again, but I really hope it's soon. So.
I know. Well, Taylor Bradford from the Gloucester Daily Times, thank you as ever for talking to us about what's going on.
Yeah, thank you so much. Have a great day.
You too. Take care. Bye.